Since I've started in the department, I realized that communities need to know what we're doing. So a part of this meeting that has been called by the legislature now is just for me to come and brief the legislature on the annual report. What have we done in the last financial year up to date, so that there is an improvement if there are no improvement. And I must highlight where there are challenges and clarify them if there are issues that they feel that they are not being clarified. But I think we have realized even in the meeting that there are quite a number of things that they are raising that are more based in the municipalities, especially in the clinics. Part of the work that I'm doing again, so the clinics, some are run by the municipalities, but it's a power that has been devolved by myself as the MEC to the municipalities. So I'm having now meetings with municipalities because we need to ensure that those services that they are complaining about, that the bathrooms are not working, it was not clean here, it was dirty, there were no bandages here, I take over that responsibility and make sure that where there is a problem, the chief director that is responsible in the municipalities employed by the Department of Health work very closely with those that are in the municipalities to ease up that pressure and the problem that you can see that is mounting. Remember, clinic is the first step of every patient to go to. So if our clinics are not to the level that is expected, everybody will have a problem.
An area of concern is the over 1 billion rand that was not spent in the last financial year. Yet there are so many burning challenges in the various health facilities around Gauteng. How do you respond to that? We spoke to some community members who are saying this is unacceptable and it cannot happen while there are so many challenges.
That amount of money that was not spent, it was coming from the conditional grant. It's not only one conditional grant that we have, so it's different conditional grants, but when it comes then, it comes as a packet now of over 1 billion, because it's 1.1 billion. But that money, we had to apply for it again. It's coming back, it's going to be rolled over to us. The advantage of me understanding the finances, I knew that some of the projects that we're supposed to do, like buying of the machines, we were supposed to buy those machines, but the money, then the financial year was closing, then we had to apply, then they are going to give us back to buy those machines. The conditional grant on infrastructure, we finished that one, because I'm sure the question that you can ask, if I'm talking about some of the infrastructure challenges, how did we perform on that one? We performed well on that one because we wanted each and every cent to be utilized. So the delay was just basically on the issue of buying some of the equipment, which we have bought it now. And I'm happy that even the provincial treasury and national treasury understood when I said this money must be rolled over because of the problem that we're experiencing. Trust me, we are all concerned that no rent must not be spent when it's being given a department. Every department must spend, and I think I'm doing that exceptionally well, because I even went to AG to explain the same thing. AG understood because I work with them on monthly basis. I work with Treasury on monthly basis.
The issue around staff shortages, that also remain another area of concern. What's Gauteng Health and Wellness doing to make sure that you close those gaps? Because it does create challenges, in particular in your clinics where people need that immediate attention and they don't necessarily have to go to the big hospitals. What is the immediate interventions to make sure that you fill these vacancies?
We're filling the vacancies as we speak. The file is with the Premier on top of his table again to check if those vacancies are funded in the provincial treasury. Then they are going to give us a go-ahead. I'm sure when I go back to the office, because I was not around last week since I lost my mother, definitely my file is ready, because the TTG was telling me that they're finalizing that process at the treasury and at the Premier's office. It's only 1,000 that is not filled. We've filled some of the vacancies on nurses. Again, in the municipalities where we have a shortage of nurses, we're trying to close that gap. Hence, this pool now that is going to come with these adverts, we're going to take it to the municipalities. But the other problem was that before, the Department of Health nationally, they stopped training of nurses. That has killed the department, because once now the senior nurses are leaving, they are going on pension. That's a problem that we're experiencing now, especially on midwifery and then on mental care.
The ongoing challenge of children at school level who are subjected to food poisoning, but the role that Gauteng Health will be playing to make sure that you are hands-on to deal with this, and just to create awareness as well.
If you remember last year, you used to see me going to the communities in the townships where we're checking the spaza shops. We never stopped that program. It's a unit on its own, but we're working with other departments. we've been doing it, working with the municipalities, because it's an integrated program, and we've been doing so well until this last outbreak now that were uncontrollable, because that one we couldn't see where does this sulfur you have seen now it's coming from where. How did we keep it? How can we keep it? So you can see, and I'm happy again because that's my department that discovered that.